Andrew, the science video?
Science? Science video? But... video game. Okay.
This is presentation of Respiratory System. It's perfect. We were initially going to do a highly sophisticated presentation featuring an intense amount of 21D graphics and all kinds of microscopic slides that are really interesting to look at and help keep the presentation moving. But after reviewing the audience that we're performing to, it might be best to avoid putting too many big words and super professional diagrams. Instead, I've prepared a separate presentation just for this particular audience. Let's begin. So if you were living in a hut in Kenya and didn't know, the main objective of the respiratory system is to deliver oxygen to the body and remove carbon dioxide. For the sake of this video, we're going to refer to oxygen as OxyClean. Your body needs OxyClean to survive in the wild. It goes in your lungs and your blood and even goes in and out of your brain. That being said, let's talk about the upper respiratory system. Upper and lower respiratory system. The cells of the human body need a constant stream of OxyClean to stay alive. The respiratory system does this while removing the carbon dioxide, which can be lethal over time. There are 3 major parts of the respiratory system. Let's get to the real presentation. I hope that you weren't actually finding that last clip educational, because if you did, you probably should drop down to the applied level. It's just a suggestion. Okay, the cells of the human body need a constant stream of oxygen to stay alive. The respiratory system puts oxygen into your body while removing carbon dioxide, a gas that can be lethal if used in place of OxyClean. Sorry, oxygen. I'm still on the Billy Mays thing. There is not an upper and lower respiratory system, but instead both upper and lower respiratory systems. The upper respiratory system is made up of the nasal cavity, sinuses, pharynx, larynx, and the epiglottis. The lower respiratory system is made up of the lungs, the trachea, the bronchi, and the diaphragm. The nasal cavity is basically just a cavity that traps dust particles and has tiny hairs called cilia to move them out to the nose to be sneezed or blown out. Sinuses are just air-filled spaces alongside the nose to help make the skull lighter. There's nothing that needs to be there, so they just clear it out. The pharynx is what both food and air pass through before reaching their destinations. The larynx is the part of the respiratory system that holds the vocal cords. It is responsible for producing voice and helps us to swallow and breathe. It lies between the pharynx and trachea and is part of the tube that carries air to and from the lungs. The epiglottis lies just at the root of the tongue and is a leaf-shaped flap of cartilage tissue. When you swallow, the epiglottis covers your larynx, where your voice box is, and stops food from entering your trachea. This contains your vocal cords and allows air to pass from your mouth to your trachea, from there to your lungs. Lungs are the main organs of the respiratory system. They take oxygen into the body and carbon dioxide is breathed out. The red blood cells pick up oxygen from the lungs and deliver the oxygen to all the cells in the body that need it. Trachea is called the windpipe. It filters the air we breathe and branches it into the bronchi. Bronchi are 2 air tubes that branch off of the trachea and carry air into the lungs. Finally, the diaphragm is a dome-shaped muscle at the bottom of the lungs. When you breathe in, the diaphragm contracts, which enlarges the space that the lungs can take up. The larger space allows for you to pull more air into your lungs. When you breathe out, the diaphragm expands, which forces the air back out. The diaphragm is the main muscle in breathing, but there are other muscles in the respiratory system. Between the ribs are many small intercostal muscles that assist the diaphragm with expanding and compressing the lungs. These muscles are divided into 2 groups, the internal intercostal muscles and the external intercostal muscles. The internal intercostal muscles are the deeper set of muscles and depress the ribs to compress the thoracic cavity and force air to be exhaled from the lungs. The external intercostals are found superficial to the internal intercostals and function to elevate the ribs, expanding the volume of the thoracic cavity and causing air to be inhaled into the lungs. When you fill your lungs with air, you don't literally just breathe in air and then your lungs fill up, because lungs aren't actually just big sacs that fill up with air and then lose all their air. Lungs are made up of all kinds of small balloon-like structures called alveoli attached to the branches of the bronchial passages. These alveoli inflate and deflate with inhale and exhale. It takes some effort to breathe in because these tiny balloons must be inflated, but the elastic recoil of the tiny balloons assists us in the process of exhalation. But of course that tension makes it a little difficult to fill your lungs. If the elastic recoil of the alveoli is compromised, as in the case of emphysema, then it is difficult to exhale forcibly. So when it comes to diseases that have to do with the respiratory system, there are two actual areas that it could affect, which would be the airway and the air sacs within the lungs themselves. Some diseases affecting the airway are asthma, chronic obstructive pulmonary disease, chronic bronchitis, emphysema, acute bronchitis, and cystic fibrosis. Hopefully, the spelling of those words doesn't make you cry blood. Asthma is diagnosed when the airways are persistently inflamed and may occasionally spasm, causing wheezing and shortness of breath. Allergies, infections, or pollution can trigger asthma's symptoms. Chronic obstructive pulmonary disease, or COPD, are lung conditions defined by an inability to exhale normally, which causes difficulty breathing because you can fill your lungs, but then exhaling is difficult. Chronic bronchitis is a form of COPD characterized by a chronic productive cough, which will follow your attempts to exhale. Emphysema is lung damage, which allows air to be trapped in the lungs in a form of COPD. Difficulty blowing air out is the most obvious telltale sign of emphysema. Acute bronchitis is a sudden infection of the airways, usually by a virus, and is not something that will last you forever. Cystic fibrosis is a genetic condition causing poor clearance of mucus from the bronchi. The accumulated mucus results in repeated lung infections and will cause you to have several trips to the hospital. The other half of the diseases affecting the air sacs are pneumonia, tuberculosis, pulmonary edema, many forms of lung cancer, acute respiratory distress syndromes, and pneumoconiosis. Pneumonia is a simple infection of the alveoli, usually by bacteria that you may breathe in that is either carried within the air or stuff getting into your lungs accidentally. Tuberculosis is a slowly progressive pneumonia caused by the bacteria Mycobacterium tuberculosis. Pulmonary edema is when fluid leaks out of the small blood vessels of the lung and into the air sacs in the surrounding area. This can usually happen from heart failure and back pressure in the lung's blood vessels, or direct injury to the lung causing the leak of fluid. Acute respiratory distress syndrome, ARDS, or severe sudden injury to the lungs caused by a serious illness. Life support with mechanical ventilation is usually needed to survive until the lungs can recover on their own, if they manage to. And finally, pneumoconiosis, such a beautiful word, is a category of conditions caused by the inhalation of a substance that injures the lungs. Examples include black lung disease from inhaling coal dust and asbestosis from inhaling asbestos dust. No, it doesn't make sense. Nice work, Matthew.